Hello and welcome to another edition of Health Matters. I'm your host. My name is Dr. Michael Chillemi. And on this episode, we are going to take a deep dive. You notice a lot of my podcasts are deep dives. We're going to take a deep dive into a condition called facets. So we're going to understand the intricate workings of the spine, common spinal conditions that affect millions of people worldwide, and that's facet dysfunction. This is one of the leading causes to neck and back pain, yet it remains a condition that isn't widely understood. So buckle up as we take a deep dive into facet joint dysfunction. We're going to cover everything from the anatomy that's involved, how it affects your life, what are the causes, some diagnosing methods, and some associated conditions, as well as treatment options, conservative and non-conservative. So with that said, let's jump right in. Segment one, what is facet dysfunction? So the basics, right? What are the basics? Facet dysfunction refers to a condition of pain, of inflammation, or mechanical issues stemming from facet joint problems in your spine. So what are facet joints? These are small joints that connects the vertebrae and allow controlled movements between them. Dysfunction of these joints occur when the joints are misaligned, stiff, inflamed, worn down due to injury or degeneration. Other terms you might have heard in the past is called facet syndrome, and that's a part of facet joint dysfunction. Facet syndrome can severely impact the quality of life, causing chronic pain, stiffness, and limited motion. So let's get into the next part of this, which is the anatomy of the facet joint. I'm going to give you a little bit of an anatomy lesson. So to truly understand what the facet joint is, we need to zoom in on the facet joints themselves. So facet joints are actually called zygopopliteal joints, which are synovial joints located between the vertebrae of the spine. They exist in pairs, one on each side, obviously two on each vertebrae. A single spine contains several facet joints from the neck down to the lower back or the lumbar spine. Let's analyze the structure. Facet joints are made up of cartilage, which allows for smooth gliding between the vertebrae. A thin capsule surrounds each joint. Synovial fluid is within the joint, which provides the lubrication, right? So that's how the joints move when we bend and twist our bodies. Location. There are two facet joints per vertebrae, one superior above, one inferior below. These joints connect the vertebrae to maintain stability and alignment. What are their roles? The roles of the facet joint are to allow controlled movements such as bending, twisting, side-to-side rotation, and they also prevent excessive motion, which could damage the spinal structures. See, the body is so smart, right? It is so ridiculously smart that it actually puts a mechanism in there to allow you to bend to a certain degree, twist, rotate, and it puts the body in an aspect of not making it hurt itself by not making it bend too far forward, too far back, right? This way you prevent tears. Think about that. How crazy is it to understand what I just said? That the body has the ability to regulate its motions based on the anatomy that it created. It is pretty fascinating when you think about it. Just think about that one little part. That is incredibly fascinating. Well, fascinating to me. Okay, so let's get into this. How are the facet joints affected? So facet joints dysfunction is incredibly common, especially as we age. or lead to sedentary lifestyles. Studies suggest 8 to 10% of low back pain cases, they specifically arise from facet joint issues. It is also a common cause of neck pain, chronic neck pain specifically. Millions worldwide suffer annually, but many cases go undiagnosed due to overlapping symptoms and conditions such as herniated discs, muscle sprain strains, risk factors including aging, sedentary behavior, and repetitive strain and trauma are the leading causes of it. So, how does facet dysfunction affect your daily life? Facet dysfunction can significantly impair your daily life depending on the severity of the condition. So, let's break it down to some of the symptoms. So, typical physical symptoms are localized pain, pain that is felt directly at the site of one of the joints. Cervical spine, you'll have neck pain, headaches, and stiffness. Thoracic spine, you could have mid back pain and muscle strains. It's often mistaken for muscle strains. Lumbar spine, which is the lower back, you could have pain that radiates into the buttocks or thighs. Other symptoms that you can have is reduced ranges of motion, stiffness and restriction of motion, basically difficulty bending, twisting, lifting, are from that. You could have increased pain when you move. So when you move and like bending backwards or twisting, you could get that jolt and cause that pain. The problem becomes, and when we talked about some symptoms overlapping, is there's a lot of conditions that have similar effects, right? Similar effects, right? So if you have a herniated disc or a bulging disc, you can twist and bend and have that same type of pain. It becomes more relevant and diagnosable when we get into some of the physical aspects of it and the physical condition of it. Let's break it down a little bit more on the impact on daily activities, right? So facet joints can limit your ability to perform simple tasks such as difficulty sitting for long periods, trouble sleeping due to pain, inability to lift objects. Walking long distances can become very painful. There are some mental and social consequences. So when you have chronic pain that's associated with facet joint, often leads to anxiety and depression and social isolation, right? You don't want to go out, you don't want to go anywhere, everything hurts, you can't really walk that far, you can't sit that long. When you have those type of condition, it can lead, when pain's limiting you, it can be very frustrating and give you a significant amount of emotional distress. So it is important to get it regulated. Okay, now let's get into what are some of the causes of it. How do you get it? How does someone just get facet joint dysfunction? And why does it happen? So some of the causes are degeneration, right? So aging. The aging process itself can lead to wear and tear on the facet joints. And over time, the cartilage can break down, causing arthritis. Another method is injuries, trauma, car accidents, slip and fall. You fell out of a tree when you were 15 and never got it treated. Here we are. Any type of injury that can cause damage to the facet joints. Poor posture, slouching, sitting awkward, putting your joints into undue stresses. Like if you sit in your chair and you put your feet underneath you, or you lay in certain awkward positions. I had a patient tell me the other day that they sleep with one leg actually off the bed. You're gonna have pain, right? So the body wasn't meant to be in these funky positions. And while it might feel good for that moment, usually you're doing more harm than good. I know people try to do it temporarily for that moment, and that's understandable, but that is not a method to sleep or to sit on your chair with one leg off your chair, hanging off, because that's the only way you can sit, right? It's not poor posture is not the way to go. Other ways you can get it: overuse or repetition. So repetitive motion, such as twisting, bending at work. Athletes can get it during activities. Let's break it down to some associated conditions with facet joint problems. So there is a condition called facet joint syndrome, right? So it's a general term for pain that originates from the facet joints due to inflammation, degeneration, or damage. Usually you have localized pain, stiffness, and difficulty moving the affected area of the spine. Facet joint arthritis or facet arthropathy. So it's basically osteoarthritis of the facet joints due to aging, wear, and tear. Symptoms usually include chronic pain, limited motion, tenderness at the area. Facet joint dysfunction occurs when the facet joints do not move properly, leading to restricted motion or pain, often associated with misalignment or strains caused by postural issues or trauma. Facet joint hypertrophy. So what that basically is telling you is hypertrophy means enlarge, right? So it's an enlargement of the facet joint due to degeneration, inflammation, or osteoarthritis. And when you have something like that, that can lead to nerve root compression as well. And if you have nerve root compression, you could have some radiculopathy, or you could have a condition like spinal stenosis. Next condition is spinal stenosis. So spinal stenosis is basically narrowing of the spinal canal, often caused by the facet joint arthritis or hypertrophy, right? So the joint itself becomes arthritis, so the space decreases. When the space decreases, that's actually now called stenosis, because stenosis means narrowing, and or hypertrophy, meaning the area got bigger, or the bones got bigger, and now your space decreased, and now that's narrowing. Therefore, that's spinal stenosis. When you have spinal stenosis, you can compress the nearby nerves, resulting in pain, numbness, and/or weakness in the local area or the extremities. Spondylolisthesis. Spondylolisthesis is a condition where one vertebrae slips forward or backwards on the bone below it, impacting the facet joint's alignment, and that can lead to pain, nerve compression, and instability. You could have facet joint fracture. So you could have a trauma or an injury where you actually fracture the facet joint, whether it's from a significant fall or car accident. You could have severe pain and swelling and instability in the area. You could have degenerative disc disease, although the primary issue with intervertebral disc disease can place a stress on the facet joints, leading to more dysfunction. So it's kind of a secondary effect. You could have facet joint cysts. So cysts are, you can have a fluid-filled cyst like a synovial cyst that develops near the facet joint due to degeneration and inflammation, which can cause nerve compression and localized pain. You could have ankylosing spondylitis. That's an inflammatory arthritis that can lead to stiffness and fusion of the spine, potentially involving the facet joints. Rheumatoid arthritis, it's an autoimmune condition that can involve facet joints, causing chronic pain and inflammation. You could have post-traumatic facet joint pain. So you could have facet joint damage or inflammation following injuries such as whiplash or falls. And you could have radiculopathy. So facet joint issues can indirectly contribute to nerve irritation or compression, leading to radicular-type pains, numbness, or weakness in the limbs. So basically, what that's really telling you is the facet joints are involved in a lot of your motion, all of your motion, really, right? So bending, twisting, lifting. And when you have irritation or trauma, you can directly affect them. And that's why you can see there's really an overlap between facet joint syndrome and a lot of other conditions. And it's really up to the doctor to diagnose you properly and rule in or out certain conditions, and therefore give you the best treatment possible. So talking about diagnoses, the diagnoses can be tricky because it mimics other spinal conditions. Doctor usually uses several methods to determine what is happening for that particular patient. So first thing you're going to understand is symptom assessment, right? Understanding the pain patterns, what it's triggered by, how does it start, when does pain worsen, there's certain movements affected. Does it happen with rest? Does it happen with activity? Is the pain localized or does it radiate? You have to really, basically what I'm saying is you have to do a significant and detailed history. And it can't be a simple 1, 2, 3, one question, two questions, okay, move on to something else. Your doc's really got to get in there and understand what is happening. And then a great physical exam, right? Your physical exam has to be great with understanding your ranges of motion, understanding all your muscle testings, understanding all your orthopedics, all your neurologicals. You would want to do some imaging studies, whether you do x-ray, which typically reveals any alignment problems of the spine, or an MRI or CT scan to really define the inflammation or degenerative changes at the facet joint themselves. Treatment options. So there are a lot of different treatment options. I know in my office, chiropractic is one of obviously the first choices. We're going to get the spine moving. We're going to get your joints moving. We're going to look to take some of that pressure off the spine. And we actually do a tremendous job treating facet syndrome and getting the spine to move. Other things that we incorporate with that is obviously physical therapy. We're going to want to include physical therapy to work on exercises to strengthen the spinal muscles, to improve posture with stretching, and it's going to try to help reduce stiffness, increased motion, and usually if it's in the lumbars, we're going to want to do some core stabilization and strengthening with that, right? So the strong core will absorb and help counterbalance some of your other issues. Other things, somewhat conservative, are NSAIDs, pain medication, over the counter. Lifestyle changes, right? So obviously weight management, obviously the more in shape you are, the more chance you have of not having joint pain due to weight management. Ergonomic changes to your chair, the way you sit, the way you get in and out of your chair, your car, get up from the couch, all these different little tricks to really twist how you actually function. Some non-conservative treatments could be a steroid injection, right? Going to your pain doc and getting a steroid injection directly into the inflammation can provide some temporary pain relief. Other treatments that they do for non-conservative is radio frequency ablation, basically used to burn the nerves that transmit pain from the affected facet joint. Other treatments that they can do is surgery, right? Facet joint fusion. In severe cases, they can do fusion to eliminate the abnormal motion. You could also do a decompression surgery, which removes tissue that is compressing the facet joint or the nearby areas. But for the most part, the far majority of patients usually utilize conservative care, right? They usually have a pretty good response, especially identifying it in the beginning. Obviously, longer things go, things get worse and worse and worse. And at some point, some of those non-conservative treatment options could be an option for somebody if all else fails. Okay, wrapping it up. Facet joint dysfunction might be a small piece of the puzzle within spinal health, but it affects and can feel monumental to the people when it happens to them, right? When it affects your ability to move, overall quality of life, and it requires careful management through lifestyle changes, chiropractic, physical therapy, and lifestyle modifications to help control it. If you're dealing with chronic back pain, facet joint issues, maybe the underlying cause, the right care and guidance, relief is possible. So if you know anybody that is having pain, has had pain for a long time, and they really haven't had a solution, please send them this video. Maybe this is something that they have. Maybe it is something that they can bring up to one of their doctors. And, whether this is for you or if you have a loved one, share this video, especially if they're battling pain. Sometimes people don't know where to get information, and if they can get anything that I said here to trigger them to go get the proper help, that would be a great day for that person, right? So you never know the effects you have on somebody else's life, and something that might seem insignificant to you might be monumental to them. And this could be the first step for some of them to really get on the right path to treatment. So, as always, I say the information I give you is not medical advice. It is my opinion alone. Please seek a doctor to determine your medical condition. And what I always say, we only got one shot at life. So it's important to take care of you and yourself, because at the end of the day, health matters. I'm Dr. Chilemi. Till next time.